Universal Family Connections monthly risk reduction program. We're coming to you from Universal Family Connection, located at 1350 West 103rd Street, where our president and founder is Dr. Lorraine Bros. My name is Jeffery Jones, and I'm going to be your co-host today. Welcome to our KNTV. Thank you for joining us for this important conversation. It's rooted in justice and joy. That's the topic: Black maternal health, HIV, and the fight for equity in our community.
Good afternoon, good evening. My name is Lade Odemosu from Universal Family Connection Risk Reduction Department. And we are here today. Welcome back, to the show. We miss you guys. So this week, between April 11 and 17, we are. It's the week that they celebrate Black maternal parents. Black women that are giving birth to babies and all that. So this is sponsored by Black Mamas Matter Alliance, and the theme for this year is actually rooted in joy and justice.
Okay, tonight we want to shine, or this afternoon, and it's been a while since we've been here. Lade and I have both been off almost since the New Year, seems like. Have we been here this year?
No.
Yeah, so we're welcoming you back, and hopefully tonight will be a really, really good topic for you. And we're celebrating, or not celebrating, but we're talking about Black mothers' maternal health, as Lade explained. And we want to shine a light on a critical but often overlooked issue, and that's the intersection between Black maternal health and HIV in the African American community.
Yes.
And these are not separate struggles. They're connected by the same systems that too often fail Black people. Unequal access to quality health care, stigma and silence, delayed diagnosis and treatment, lack of culturally responsive care. That the doctors don't understand us, and the long-term impact of the impact of structural racism. So we're going to talk about all of that.
And this conversation is not about fear at all. It's about facts. It's about compassion, action, and it's about making sure Black women, Black mothers in general, Black families in communities are informed, protected, and empowered.
Amen to that. So tonight we'll talk about why Black maternal health matters.
Okay.
We'll also talk about how HIV affects African American communities, because as we know, and we talk about it every month, HIV is still prevalent in the African American community, and it's not often talked about because we've almost had 40 years of HIV intervention and prevention and treatment, and so, but we're still fighting with this challenge, and so that's why we come every month to talk about HIV. We're going to also talk about how pregnancy, postpartum care, and HIV prevention intersect.
Okay.
And also, finally, and what solutions look like when communities lead the way. So let's begin.
Yeah, what is Black Maternal Health Week actually? Why does it matter? I think it was created to raise awareness and demand action around the crisis facing Black mothers
All right.
in America. The reality is painful, but necessary, But Black women continue to experience significantly worse maternal health outcomes. They are most likely to face during pregnancy, childbirth, and the postpartum period. They are also more likely to die from pregnancy-related crises if care is not taken.
Say that again, Lade. What's that last part you say? They're likely to what?
Mostly likely to die from pregnancy-related causes.
So their counterparts, other races, are not subject to the same treatment as African American or Black mothers during pregnancy, and so we're going to really look at that closer tonight.
And it is not because they are weak or not because they do not care for themselves. It's not because they love their children and everything, but the system has built it in so many ways to dismiss Black pain and delay Black diagnosis, underinvest in Black communities, and ignore the expertise that needs of Black women themselves.
Right, and so these are the things that we're challenged with, and Black mothers are challenged with during pregnancy over the 9 months. That's why the theme this year is rooted in justice and joy. Because it matters so much. Justice means access. Justice means respect. Justice means protection. Justice demands accountability. And joy means Black families should not fight for survival, but should always be able to experience healthy pregnancies, safe births, supported postpartum recovery, and thriving futures. This movement here that we're talking about today, Black Mothers Maternal Health Week, is rooted, it calls for culturally grounded health care, reproductive justice, expanded doulas and midwife support, better postpartum care, policy advocacy, and community-led solutions. It's going to take the whole village, not just mothers, but it's going to take the whole village advocating for healthy pregnancies in our communities. And when we talk about maternal health honesty, we must also talk about HIV. And because HIV is not just a medical issue, it is also a maternal health issue, a family issue, and a justice issue.
Oh, yes. And I agree with that part because even when regular people go to the doctor, if you don't request for HIV tests to be done, it's not part of the general physical routine.
Exactly.
To talk less of pregnant women, I think the focus is more on kids in a better hospital, but in a community hospital where there's population of Blacks, it's almost impossible,
Exactly.
Even though Black people do not make up majority of the population, we continue to carry a disproportionate share of HIV cases. That means the burden is heavier on in Black neighborhood and in Black families, to be honest. The reason are not about moral failure from Black people. It's just that they don't have access to preventive care. They have limited access to testing, inconsistent insurance coverage, stigma around sexual health, untreated trauma, medical distrust, poverty, unstable housing, and barriers to ongoing treatment.
This is so important, and that's one of the reasons why last year, a year ago, as a matter of fact, our agency, Universal Family Connections, purchased a mobile medical unit so that now that we can increase the access, we can go to places where people are unable to access health care. And so we can go out and do the testing, HIV testing, hepatitis testing. We can do education on the mobile medical unit. And so we're expanding the opportunities for people, especially in our communities, to receive health care.
Yes, and if you are interested in us coming to your community, you can always reach out to us at Universal Family Connection. We are at 1350 West 103rd Street in Beverly area of Chicago. The phone number is 773-881-1711. And you can ask for Juliet Jones, Lade Odemosu, Jeffery Jones.
You know, getting back here, in many black communities, HIV is wrapped in silence. People are afraid to get tested. There's still a stigma. People are afraid to disclose.
Yes, so true.
Oftentimes, people don't seek care until they're in the final stages of HIV. Because they're afraid of being judged. And so that's one of the reasons, and we're going to continue to talk about it, Lade and I and the Universal Family Connection, and let people know that you don't have to suffer in silence, and that HIV is no longer a death sentence. We have awesome treatments. But we're going to still talk about U equals U. That means that if you're undetectable, and you're taking your medication, you're untransmittable. So that means that you can still have unprotected sex and enjoy your life as long as you're under the care of a healthcare professional. So we're going to be talking about that.
Don't forget silence delay treatment. Seriously, if you keep silence and you are feeling somehow and you don't go and get tested or diagnosed, delayed treatment leads to worse situation.
Exactly.
To worse outcomes.
And
so,
the longer you wait, they talk about Magic Johnson, even about 35 years later, of how he was detected very early. So now he looks really good. He got the medications that he needs, the same medications that's available to the general public. You can have access to those. So you don't have to suffer in silence. You don't have to be afraid to get an HIV test. You don't have to be afraid of disclosing your status. You can talk about your status.
Yes.
And like
you said, it's no longer a death sentence.
Exactly.
It's not, because people are getting treated. A lot of people are no more. Their viral load is so low, they cannot transmit it to another person.
Exactly. And so there's a lot of treatment that's going on. And there's also treatment to, you can get, what is it called, Lade, where you can be treated prior to getting HIV. What is that called?
PrEP.
Right. So it's that's a treatment where you take a pill or take a shot that stops you from even contracting HIV. We're going to be talking about that in days to come. Today, HIV is no longer, like I said, an automatic death sentence people once feared. With early diagnosis and consistent treatment and support, people living with HIV can live long, thriving lives and productive lives. They can work, they can parent, they can love, they can thrive. And they can build healthy families. I know several of our clients who are married and living happy lives and HIV positive, and even have children after their diagnosis. So a healthy life is possible, but you have to be willing to get tested and get your results and then get treatment if you are found to be positive. And yes, women living with HIV can have healthy pregnancies.
Yes.
And deliver healthy HIV negative babies when they receive the right care.
Yes. Keep in mind, don't forget, knowledge saves lives. Testing saves lives. Treatment saves lives. Compassion saves lives.
Exactly. And that's the message
this-
that our community needs to clearly hear,
Yeah.
that it saves lives.
It does.
And you know, one of the things that I'm really impressed with, and our whole staff, is the compassion that's shown around HIV and around the population that we service. You know, the compassion that is often displayed. So, and that compassion saves lives.
Yes, it does. And that's exactly why we have to talk about the intersection, how, access, how people can have access to kind of bridge whatever it's separating them from achieving all these goals. We are, just like we're talking about Black Maternal Week. This is Black Maternal Week, and in relation to HIV as well. So we are also, for intersection, there should be access to prenatal care. Women prenatal care is very, very important for screening, education purpose, and intervention. If they are positive, HIV testing during pregnancy is very important and can help to identify infection early than, so that the mother can protect, the child can be protected, and the mother can be protected as well. Because being net positive does not mean you are going to have a positive baby.
Exactly,
Yes.
exactly.
And then, but when prenatal care starts late, it's always a problem. It's hard to detect on time, and opportunities are missed.
Exactly. And that's why this subject is so important, intersecting HIV care with Black Maternal Health Week. Stigma in maternal health care. Let me say it again, stigma.
Yeah.
Some women may avoid care simply or withhold information because they fear being judged for their sexual history. We don't use the word promiscuous. You can have as many sex partners as you like, and we don't judge you.
Yeah.
These mothers are afraid of their possible HIV status.
If you don't disclose, the doctor can't help.
And so they withhold their information.
Yeah.
They won't expose oftentimes their drug use history.
Yes.
Or their relationship status, or even their financial struggles. And keep in mind, stigma can keep women from telling the truth. Basically, it's hiding what they need to share the doctor with. And if women cannot tell the truth, providers cannot fully protect them.
Exactly.
Say it again, if women cannot tell the truth, then providers cannot fully protect them.
That's right. And maternal health does not stop at delivery. It goes beyond that. It goes beyond, which we call postpartum vulnerability. If you don't continue to access care, there's a possibility of depression and isolation, partner violence, housing issue, unstable housing, interruption in medication, and and so forth, so more and so forth. So follow-up care is very, very important. Even if that person is positive,
Exactly.
they have to follow up after delivering the baby so that they will not fall into all this category of depression, and because sharing with someone helps.
Exactly.
Yeah. And I mean, someone like I said, it's if they don't access the support, they become weak, and the follow-up care is messed up.
Exactly. And a mother living with HIV or at risk for HIV may be especially vulnerable during the period following the postpartum period if support systems are weak. So, and we're going to move to our next subject, reproductive justice. We hear a lot of talking about social justice, where there's something called reproductive justice. Every black woman has the right, listen again, every black woman has the right to have a child if she decides she wants to have a child. They have the right not to have a child as well, and to raise children in safe and healthy communities. That's reproductive justice. This also includes the right to have HIV prevention.
Yeah.
You have the right to informed consent, respectful maternity care, safe birthing options.
Yes.
You also have a right to postpartum support. And finally, you have a right to freedom from shame and discrimination. And so we really want to make sure that women know their rights. And so that's some of the things that we teach when we're doing our education. You have a right to these, to just have a healthy life.
No, many of the tools that improve these maternal outcomes also improve HIV outcomes. It goes hand in hand, and it will be based on trusted community health workers, patient navigators, outreach teams, in transportation help, case management, mental health support, family-centered education, and culturally responsive providers.
Exactly. And it's so important to have all of these as a group.
Yes.
As a group. And one of the things that I heard you say was the doulas. Really, doulas are so important. We have 5 minutes left, so we're going to really try to get as much of this in as possible. Why this matters for black women and families and babies. This conversation is about more than statistics, about people. It's about black mothers who feel dismissed when we say something is wrong. It's about pregnant women who has not been tested because no one explained why it matters.
Yes.
It's about the women living with HIV who wants a healthy pregnancy but is terrified of judgment.
Yes.
It is about the grandmother helping raise children because systems failed their mother.
Yes.
It's about the father who wants to support but does not know how. This is about the baby who deserves the best possible start in life. HIV prevention and maternal health support are both family issues. Healthy mothers support healthy families. Healthy families support healthy communities.
So when a black woman receives quality prenatal care, HIV screening, respectful treatment, and postpartum follow-up, that is not just individual victory. It is the community victory and community health in action as well. So it is very important that underserved community, this is what this program is all about anyway.
Exactly.
That they reach this level, and the harm is not individual alone. The harm ripples onward. And that is why work must be community-wide, like I just said. You know, churches must be informed, families must be informed, partners must be informed, providers must be informed, and the public must stop treating this issue like private shame. when they are actually public health and justice issues.
Amen, amen. Finally, our solutions. What justice and joy look like in practice? So what does this look like to move from awareness to action?
Yeah.
What does being rooted in justice and joy actually look like?
Yeah, black
It
women.
looks like this.
Okay.
Culturally responsive healthcare. Black women deserve providers who listen, believe them,
Yes.
explain clearly, and treat them with dignity.
Yes, routine HIV testing and education, strong linkage to care, doulas, navigators and community support workers, postpartum support, honest community education, addressing the whole person, policy and system change. Community action matters, but policy matters too.
We need investment in maternal care, reproductive justice, HIV services, postpartum care, and community-based Black-led organizations. That is what justice looks like in joy. Joy looks like a Black mother being safe.
Yeah.
Joy looks like a healthy pregnancy.
Yes.
Joy looks like an HIV-negative baby when prevention was possible. Joy looks like a woman living with HIV receiving care without shame. Joy looks like a family supported instead of abandoned.
Yeah, so the call to action is, as we close tonight's conversation, Black Maternal Health Week is not just a celebration, it is a call. It's a call to listen, a call to respond, a call to build systems that honor Black lives, and HIV in the African and American community cannot be addressed through silence, through stigma, or blame. It must be addressed through education, testing, treatment, trust, and based care. So get tested, stay informed, support Black mothers, support Black families, advocate for respective care, challenge stigma, build trust, and invest in solutions that come from the community itself.
Let me end with this. The intersection between Black maternal health and HIV teaches us something powerful.
Yes.
When Black women are protected, families are strengthened. When Black mothers are supported, communities are healed.
Yes.
When healthcare is rooted in justice, dignity, and cultural understanding, joy becomes possible.
Yes.
Because Black mothers deserve safety, Black babies deserve healthy beginnings, Black families deserve dignity, and our community deserves both justice and joy. Thank you for joining us this evening. Thank you for KNTV. Continue to learn, continue to speak up, and continue to support the health and future of our people. This is Universal Family Connection. My name is Jeffery Jones, and I'm your host for this week.
My name is Lade Odemosu. I'm your co-host for this week. Thank you for listening, and hopefully you will gain some knowledge from this discussion.
And again, our website is www.universalfamilyconnectionchicago. That's universalfamilyconnectionchicago.org. And again, we are located in the Beverly area at 1350 West 103rd Street in Chicago. We can be reached by phone Monday through Friday at 773, I'm sorry. I'm about to give you my cell number. 881-1711. And also, we're going
we have, you are welcome to come in and test. We are open to test anyone that walks in. And we also have another office on 7949 Southwestern, which is our sister office, where we go to test people in that area as well. So you are welcome anytime. Stay safe. God bless you.
And have a good month.